Hey Christian, this is Dan Toner. Thanks for forwarding this to any PavXpress employee. Two purposes of this recording. Number one, for those participating in the health plan today as of February of 2021, we're changing from Cigna to Trustmark starting March 1. You're also maybe getting this link if you're a new employee during the year and you can enroll under the Trustmark plan. My name is Dan Toner. This is my website, FFP Employee Benefits. You can certainly contact me through the site. I'm also giving you a memo with my contact information, but this is my website and this is my information right here on the screen. We're going to go over the attached, we're sending an email that has a bunch of different attachments to it. This is, so I'm going to review that, and any questions, please feel free to contact me during the year. So first and foremost, the new health plan is going to start March 1 and it'll renew every March moving forward. The memo just explains who's eligible, and there's a 90-day waiting period for new hires. Let me tell you about Trustmark. Trustmark is a large national third-party administrator, and what that means is they work exclusively with larger companies. The power of Trustmark is you're not restricted to any network of doctors. You don't have to worry about if my doctor in the Cigna book or Blue Cross or Aetna, etc. You can use any doctor you want, which is great. The health plans have 100% coverage for well visits, like all plans. And this plan is significantly richer than Cigna in terms of coverage, and we're going to go over that. You do not need referrals to see specialists. And if you get any bills from a provider who doesn't agree with Trustmark's rates or claims, there's a special toll-free number and a service that takes care of those bills for you. So on the memo, I put side by side so you can see the Cigna plan on the left and the new Trustmark plan starting March 1 on the right. At the bottom, there's a little footnote that says DW is deductible waived, AW is after deductible. So for example, with Cigna, if you went to a primary care physician, you owed a $2,500 deductible if you were single and a $5,000 deductible if you had one or more dependents. You don't have those deductibles under Trustmark. You have a copay for a lot of services. So for example, if you went to a primary care, you had to meet either the $2,500 or $5,000 first, and then you paid $30. Here you pay $25 right out of the gate. Specialist copay right out of the gate. So I'm going to highlight in the next page all the differences. All right, so that's just a quick summary side by side. Here's the highlights. When you went to a primary care, you owed 50% after either of those deductibles. Single, 25, family, 5,000. Trustmark is now $25. Specialist, 50% after deductible. Now it's $25. If you had an x-ray or lab, you had to meet your deductible first and own half. Here, you get 100% coverage for the first $250 and then 50% no deductible. Much better coverage. Huge benefits here for urgent care and emergency room. Those were all part of your deductible. Now you pay $50 no matter what urgent care center you go to, and $750 no matter what emergency room you go to. Always incentivizing you to try to use urgent care guys instead of emergency room, where your costs are lower, but it's still significantly better than what we had with Cigna. For medication, again, all part of your deductible before. Wonderful news. Now it's all a copay. You'll pay a maximum of a $20 copay for generic drugs. A lot of places have $2 drugs and $4 drugs and $8 drugs for generic. You'll pay no more than $20. If you take name brand, you'll save significant money as opposed to having the drug go towards a deductible. You'll either owe a $65 or a $95 copay. You can work with customer service, and I'm sure it's online, to tell you whether or not it's the 65 or 95. This is like a level 2 and a level 3. So that's how you determine. They're called preferred and non-preferred. Another huge difference with radiology. Instead of having your MRIs, CAT scans, and PET scans part of the deductible and covered at 50/50, you only owe a $300 copay. and then you can go out of network. You couldn't go out of network before. The doctor had to be in the Cigna directory. Now you can go to any doctor you want. Now, for larger claims, hospitals and surgery, the Cigna plan had those subject to that same deductible. Here, there is no deductible, but they're going to charge you a $2,000 access fee, and then you owe 50%. Your catastrophic worst case scenario, if you're a single, from January through December is $6,350. What that means is you can't pay more than $6,350 no matter how many times you have bills. You may owe the $2,000 access fee first for a hospital and surgery bill and then owe 50%, but you can't spend more than $6,350. If you have dependents, they'll each owe $6,350, but they'll never collect more than $12,700 for the family. That's what that means. With Cigna, that out-of-pocket was $5,000 for a single and $10,000 for a family. So it's close. I know those were lower out-of-pockets, but with the above scenario, we thought the Trustmark plan was significantly better for everybody. Okay. These are the costs. They're very similar to the costs from Cigna. So we were basically able to match a lot of the premiums. These are the total rates minus the 50% from Pav, and then your deductions per check are at the bottom. The website for Trustmark is trustmarksb.com, where you can log in once you get your ID card, see your claims, print new ID cards, see explanation of benefits, etc. I am the insurance agent. Debbie is my right hand in case you need her, and then Sandra helps with enrolling. So that's just the memo, just to explain. This is the benefit summary that explains a little bit more detail. By the way, telemed, use it. You pay nothing for telemedicine. So try to use the 24/7 call in. They can order drugs for you too. That avoids you having to go to the doctor and pay $25. So use the telemedicine service, and then everything I explained before is sort of covered in this benefit summary. This is what you could do online. You're going to get this document, what you can do on trustmarksb.com. This is what your card is going to look like and some information about it. Remember, this plan, you can use any doctor. So this is a little 3-page memo about, I'm sort of used to a network, like I had Aetna, I had Cigna, I had Blue Cross, I had Oxford. Everyone's used to that. Great news here. You can go to any doctor you want. So take a peek at this. They give you some advice on go to Healthcare Blue Book to pick the right doctor for you, but you can see any doctor you want. And then I have another memo with 3 important notes using the doctor, any doctor you want. There is a comment here made about how much you owe. One of the documents that we're also attaching is if your doctor doesn't agree, or your facility, like a hospital surgery, doesn't agree with the Trustmark reimbursement and you get a bill, we're going to also attach what to do with the bill. You simply send it to Trustmark. Within 60 days, they will fight the doctor to try to keep your costs down, and at a worst case scenario, they'll pay the claim within 60 days. So they don't want you hassled with a balance bill. If you get your bill, and that's more than the copay, simply send it to Trustmark. We'll give you instructions on how to do that on email. You'll get part of the email attachments you'll see have where to send that, and let Trustmark handle it. Bottom line is you only owe the $2,000 access fee plus the 50%, and Trustmark's going to tell you what you owe, and that's all you have to worry about. Okay, so I hope that explains the plan. I think we think this plan, because you can use any doctor and hospital you want, is going to be a significantly richer concept for us. Again, tremendous amount of benefits from day one, copays, office visits, x-ray lab, pharmacy, urgent care, etc. So we think this is going to be a good plan for us, and we're hoping we keep it for years to come. Okay, any questions? Again, I'm Dan Toner. Have a great day.